need it when you're losing water and nutrients from your body. That is either due to diarrhea or due to vomiting. Diarrhea does not mean frequent formed stool. What we mean is watery stools, or when the liquid content of the stools are increased. ORS is constituted by, besides water, it has glucose and other electrolytes like sodium, potassium, etc. So you just cannot use ORS as a rehydrating solution when you're thirsty. Remember, it contains certain electrolytes. So you need to use it when there is loss of water, dehydration. So vomiting, diarrhea, heat stroke, these are the conditions when you are supposed to use ORS and not just like a healthy drink. In the market, we would initially get 2 packets, which is one small packet is to be mixed in a glass, which is 200 ml of water, and the big packet is to be mixed in 1 liter of water. I insist that all of you must read on the packet of ORS because it contains both in English and in the regional language, Hindi, etc., how to prepare. You should not use a small packet in 1 liter. Similarly, you should not use a packet meant for 1 liter in 200 ml because that can give rise to problem. You are supposed to use ORS after you lose that water or electrolyte from your body. So it depends as many times as you have vomiting or diarrhea. Our body, like 6-70% is water. So it depends. If you are 50 kgs, then your volume is different as compared to a child who's 10 kgs. So the proportion of the loss of the body, that's what you need to give. On an average, I can give you some suggestions, is that a baby who's less than 2 months old, we assume giving 5 teaspoons of ORS should be okay. 1 teaspoon is like 5 ml. So between 2 months to 2 years, I would say approximately 1/4 to half a cup after each loose stool, depending it was medium or a large stool. And if it is more than 2 years, I would say half cup to a cup, which is, between 75 to 150 or up to 200 ml. And in an adult, usually we say, assess what, the stool volume you're losing, and generally we say a glass of water after each loose stool. Generally, what is written on the packets is that we can store up to 24 hours once the solution is made. That is, you mix the packet, the normal packet, which says the big packet, in 1 liter of water. So the common myths, you should not give tea to a child who's vomiting with, or having diarrhea, and people use sugary drinks like apple juice or fruit. These type of drinks are to be avoided. All conditions where there is loss of water from the body, especially in the form of diarrhea, can be managed with ORS. Only issue arises that if you have excessive vomiting, then you may not be able to tolerate the ORS, and that is the time we say that you need to go in for an IV drip because you're not tolerating the ORS, especially a small. If you are, irritable and you're getting very dizzy, drowsy, unconscious, these are the indications. Eyes are sunken, that means you're not able to cope up. That is the time you must go to the hospital, and the doctor can decide whether he would want to continue with ORS or give you an IV drip, because this is called as some signs of dehydration. And sometimes when the child is extremely thirsty, but is not able to accept orally. So that is also an indication that you would need an admission. And of course, if you have blooded stool, you must go to the doctor to get the right treatment.